Northeast Tonight, brought to you by Oil India Limited, conquering newer horizons.
Hello and welcome to Northeast Tonight, the show that decodes the region. Novel coronavirus or COVID-19 cases in India, viewers, is touching 170, including 25 foreign nationals with 3 deaths so far. More than a dozen have already recovered. Northeast India too is on high alert, with every passenger, domestic or foreign, being screened at airports and screening intensified at railway stations and interstate and international road entry points. Fortunately, there has been no positive cases reported from anywhere in the Northeast. In Assam, the state with the highest population in the Northeast too, no positive cases have been recorded as yet. State governments in the region have shut educational institutions and public places like gyms and swimming pools, bars, spas and beauty salons, and have advised social distancing by avoiding all large gatherings. Despite these measures, there is a sense of unease with information and disinformation flowing freely through the social media or word of mouth. Are cases in the country low, or are there no positive cases in the Northeast because testing kits or testing facilities are inadequate? Are potential carriers of the virus not reporting to health authorities? Are people's travel history not recorded or screened effectively? These are some of the frequently asked questions, besides questions on the virus itself, like, are masks mandatory? How long does it take for symptoms to appear? Can sipping hot water kill the virus? Is alcohol helpful? And so on. To talk about the situation in the different states in the Northeast and also answer some of the often asked questions, I am joined by Principal Secretary Health in the Government of Assam, Mr. Samir Sinha. From Philadelphia in the United States, I am joined by Dr. Rifat Mannan, Assistant Professor of Pathology at the University of Pennsylvania. Mannan hails from Assam, in fact. Superintendent of the Guwahati Medical College and Hospital, Dr. Raman Talukdar, is also with me. In Shillong, I have Dr. D.M. Thapa, Director of NEGRIMS, one of the state-of-the-art health facility in the Northeast. From Imphal, I will soon be joined by Dr. L.R.K. Singh, Additional Director of the Manipur Health Services. From Kohima, I am joined by Dr. Nyan Kikon, Nagaland's Nodal Officer for COVID-19. And in Itanagar, I have Dr. Dipu Lawang, a public health specialist. Gentlemen, welcome to Northeast Tonight. I'd like to start straight with you, Mr. Samir Sinha. Assam being the biggest state or state with the largest population in the northeastern region, we have seen that Assam has been quite proactive right from the beginning, ordering partial lockdowns, creating awareness, generally creating a buzz around how to battle coronavirus. Now, can you give me an overview, Mr. Samir Sinha, of the prevention measures for coronavirus in Assam, that you have drawn up across the state?
Yeah, I would like to brief you. In fact, we were one of the first, prime movers as far as combating corona goes. More than 1.5 months back, we started our activities and preparedness at different levels. As you are aware, in such situations, what happens that there are multiple tasks to be performed.
Right.
We need to screen people. Our entry access will have to be kind of completely brought under surveillance. Then our own internal capacities of health department per se, the hospitals, at different tiers, maybe medical colleges, private hospitals which are there in the state, the district hospitals and their capabilities, how equipped they are, the training of health professionals, adequate supply of medicines, quarantine facilities, isolation facilities, ventilation facilities. So this is the kind of internal exercise, and thereafter a large chunk actually depends on the general awareness, because this is something which is completely based on awareness level of the community. So we were one of the, as I told you, we were one of the first states, in fact, were the prime movers as far as the northeastern states concerned. In fact, we started with our airport access, our railway platform access, general awareness guidelines were issued. And importantly, we worked on our internal systems, and we have issued a series of guidelines and advisories, and our team is working 24/7 for the last 20-25 days now.
Okay. Mr. Samishna, we'll expand on this. I'll also talk to you about how many case tests have been done, what is your hospital preparedness, and so on. Let me go to you, Dr. Rifat Mannan in Philadelphia, United States. Rifat Mannan, you know, basically, from the United States point of view, what has been your experience so far in dealing with the pandemic? You know, that is something very interesting. So that, you know, we have a huge panel in the program today. We have got a very distinguished panel today. We would, first of all, learn from you your American experience in dealing with the pandemic.
The situation in the US arising out of coronavirus or COVID-19 is actually pretty grim. It is becoming obvious that the country was slow to react to the imminent danger and paying a very heavy price for it. Talking about numbers, as we speak now, there are over 8,300 confirmed cases of the disease with over 130 deaths so far. And in fact, in the last few days, there has been an exponential increase in the number of positive cases.
Exponential increase in the number of positive cases. Dr. Mannan, I'm coming back to you. I will also come to you, Dr. Raman Talukdar. Very quickly, I'm going to Shillong to Dr. D.M. Thapa, the director of NEGRIMS. Dr. D.M. Thapa, you know, what is a bigger challenge? Your medical preparedness is a bigger challenge, or making people aware of the do's and don'ts? What has been your experience in the last few weeks?
The biggest challenge is to make the public aware about the do's and don'ts. So the washing of the hands and keeping a social distance and the cough etiquettes, these are the most important things for us. And avoiding going into the large gathering and not to...
So you are saying that...
So that the people don't get infected.
Okay. Now, medically, if I ask you, what is your preparedness from the medical point of view? Are you prepared? Do you have enough testing facilities? Do you have the kits? How is the situation in Meghalaya?
Yes. Actually, we had set up this testing lab in NEGRIMS, and 3 samples have been tested till now. And none of them has been found to be positive at the moment.
Okay, that is good news. I'll come back to you, Dr. Thapa. Please. I'll come back to you. Dr. Thapa, I'll come back to you in a minute. Dr. Raman Talukdar, you are the superintendent of the Guwahati Medical College Hospital, you know, one of the largest hospitals in the entire northeastern region. You have a huge responsibility. Can you first of all tell me, you know, what is the preparedness, before I ask you to talk about the symptoms, which everybody knows by now, but still once again to put on record. Before that, how is your preparedness at the GMCH?
Guwahati Medical College is prepared with the isolation ICU, and under the leadership of our Honorable Health Minister and senior health officials, Someshna sir is there in the studio, so Honorable Goel sir and MD NHM, they are constantly monitoring. In fact, that day Someshna sir, he instructed and reviewed the whole situation, and he found out certain lapses. Accordingly, he has taken prompt action. And in Guwahati Medical College, we are having one isolation ICU. Besides that, we are increasing the number of beds. And we have arranged yesterday, we have earmarked an area which is being placed for the screening of the patients suffering from fever, cough, and cold. They will be directly guided to that area, and the group of medical and health officials will be there. Doctor and paramedical will be there, and they will examine the patient. And accordingly, if requires to be collect the specimen and also throat swab or nasopharyngeal swab, whatever may be, this will be arranged to collect there.
So how many, Dr. Raman Talukdar?
Examination room,
right.
And after examination, the specimen, that is throat swab or nasal swab being.
Okay. Now, how many tests have been conducted at the ZMCH? And I will ask the Commissioner about the overall Assam figures, but can we have a view from the Guwahati Medical College? How many tests have you conducted and what are the results so far?
Till yesterday, we have conducted 34 number of tests, 12 being collected in Guwahati Medical College and 24 being brought from other areas. So today, 2 samples being sold, so 36 number of tests being performed, and till now all are negative.
Okay, that is good news. I'm coming back to you in a minute, Dr. Raman Talukdar. Let me quickly go to Kohima. Dr. Nyan Kikon, what is the situation? As I asked our panelist from Shillong, the director of NEGRIMS, he says making people aware is the biggest challenge. How is the situation in Nagaland? How easy or difficult had it been for you to make people aware, to keep distance, not to have large gatherings and so on? And what are some of the measures that you have taken so far?
Okay, I'll start off with the preparedness level in the state of Nagaland. Since receiving letter from the Ministry of Health and Family Welfare, Government of India, on 17th of January, we have activated the State Public Health Emergency Operations Center on 18th of January. Since then, the highest level from the political side, the Chief Minister, the Health Minister, the Cabinet Secretary, who is the Chief Secretary, and the departments, they have been on high alert and they have been monitoring the preparedness level at the highest level. Now that we are moving on to the stage 2 preparedness in our state, all the various agencies of the state have been activated, and we also have the special action group constituted by the government of Nagaland. And in fact, one of the main areas and focus of our government of Nagaland is for creation of mass awareness right up to the last man in the rural areas. So concerted efforts have been put in place by all the various agencies of the department.
All right, so awareness has been your focus. I will talk to you about the total number of testing facilities and so on in a minute. Let me quickly go, before I come to Mr. Samit Sinha once again, Mr. Dipu Lawang in Itanagar. Mr. Dipu Lawang, Arunachal Pradesh is a sensitive state. You share a large border with China, although we know that there are no border points where people cross over and so on, but you cannot be complacent. So what are some of the steps that Arunachal has been taking?
The state of Arunachal Pradesh have a meeting on training of all the district officials on 13th of this month, and accordingly all the district officials have been directed to just do a very nice surveillance of the cases in districts, and also to look out any porous infiltrations of any from across the borders. So these are all have been given, all strong instructions have been given to all the district surveillance unit to just look upon all these factors also. Otherwise, like the state doesn't have any case of a COVID-19 so far.
Okay, surveillance is the key. And I'll come back to you in a minute. Mr. Samit Sinha, there is a general feeling, and some apprehensions expressed by some health experts, both within and outside the country, that India, they may not be conducting tests, that many tests, and therefore, the number is low. How do you respond to this kind of an argument? Not many people are buying this argument, of course. What do you have to say? And you can focus on your experience from Assam.
We are following Government of India advisories and ICMR guidelines on this. And initially, as you were putting this question to Superintendent Guwahati Medical College, we didn't have any facility here to start with 1 month back. Thereafter, we requested Government of India authorities, and thereafter one lab started functioning in GMCH, which has done the maximum number of tests so far. He gave you the figure, the superintendent. Thereafter, the idea is that to expand this facility across Assam. So the second center came up in Lahowal in Dibrugarh district. In Upper Assam, it can actually cater to some of the portions of Arunachal Pradesh and other states also.
Right.
And the third facility got operational in Jorhat Medical College. It is housed in. And the fourth one is going to start, or has already started from today, the Silchar Medical College. The idea is to expand such facilities, get enough number of kits from Government of India, so that testing can actually take place. While doing so, we are ensuring completely the Government of India guidelines in this regard, and of course ICMR, and in fact every day through video conferences, through meetings, through telephone calls, we are getting a lot of instructions and a lot of guidance. So we are just following that.
Okay. Now you see, you said the breaking news here at this point in time is that there is one more testing facility that has started in Assam. That is what the Principal Secretary Health, Mr. Samir Sinha, is saying, that these are the Silchar Medical College. So Assam now has 4 testing centers for coronavirus. Now, do you have enough testing kits available? Are we in a comfortable position in Assam, Mr. Sinha?
The testing kits are provided by National Institute of Virology, Pune. And we are getting, in fact, we have used the maximum number of kits in Guwahati Medical College. And in other places also, the kits are coming. Of course, whenever the meeting taking place and whenever requisitions are being expressed, obviously we are asking for more and more testing kits. As we enter the crucial phase of COVID-19, when they are talking about community transmission and the second phase coming to an end when one-to-one transmission was taking place. So there could be requirement of more people being tested. So we have already given this requisition to Government of India, and we are taking it up regularly.
Okay. Now, Mr. Raman Talukdar, there is a shortage of masks in the market. I'm not talking about only Assam. There is a shortage of masks in the market. There is a shortage of hand sanitizers. We can understand about hand sanitizers, but a lot of people are asking the question, is masks mandatory? Is masks really necessary? So there is a lot of confusion on this. What do you have to say?
There is specific guideline from the World Health Organization and the CDC that there is no point of wearing mask by the general public, but the service provider, the health workers, they are supposed to put on surgical masks. And there is some confusion among the public also that they should go for the N95 mask. Basically, N95 is a specialist devices, and that requires to be used by the patient who is suffering or who is suspected to be suffer from coronavirus, and the doctors or the paramedical staff who is going to treat the patient. In these two conditions, the N95 mask requires to be used. But otherwise, the surgical masks are to be used by the health workers. And the sanitizers, if we use the hands continuously, then definitely it is quite good enough.
Okay.
Because we know that is the virus get transmitted from the surface contact. So if we go continuous using of the hands, this is equally good enough, and this is as per the guidelines.
Okay, now Dr. D.M. Thapa, I'm coming back to you, Dr. Raman Talukdar. Dr. D.M. Thapa, is there a treatment protocol recommended by the Government of India? You see, now we were looking at a report this morning, the Sawai Man Singh Hospital in Jaipur, which have successfully treated a infected patient from Italy. He was a positive patient who was an Italian. He was successfully cured at the Sawai Man Singh Hospital. They said they have treated him with malarial drugs with a combination of other drugs So I'm asking you the question, is there a treatment protocol either by the ICMR or other competent Indian health authorities?
There is no prescribed treatment protocol from the ministry as well as from the ICMR. So whatever people are doing is they are only hit and trial basis. They are using the things. Basically, these viral diseases have a self-limiting course most of the times. So the major procedure you have to adopt is to isolate the patient, put in quarantine. Only when they are symptomatic or they have a respiratory distress, they have to be brought to the hospital. Otherwise, they can be isolated at home or in isolation wards. So that is the protocol which is being followed.
Okay.
We have not come across the patients of the coronavirus at the moment. So that is why we have not even thought about using a treatment protocol.
I'll come back to you, Thapa, with this same question to all the panelists actually. Mr. Kikon, Dr. Kikon, suppose you have assuming we don't want it anywhere in the northeastern region, but suppose you have someone who is infected. Is there a standard operating procedure as far as treatment? We all know now, by now we know that it has to be quarantined, you have to keep him in an isolation ward, that is all right. But what will be the course of medical treatment? Do you have an understanding of that? Do you have some kind of an idea, at least guidelines?
Okay. Yes. The guidelines that we will be following as per the standard operating procedures and protocol is the directions given to us by the Ministry of Health and Family Welfare. So at this moment, there is no direction from the Ministry of Health and Family Welfare with regard to direct treatments or use of anti-malarials or a combination of drugs. I am aware that a team of doctors have gone to see the veracity of the Sawai Mansingh Hospital in that place, but just to expand on the little things, the preparations that we are making is that we have also sealed all the international borders. We have also banned the entry of foreign tourists, and also we have implemented and enacted the Epidemic Act, and also we have expanded screenings of all the entry points, that is all the entry points of our neighboring states, and also increased screening in the railways and universal screening for all passengers, either domestic or international, who come to Nagaland. So these are some of the steps that we have taken, and we have also gone around trying to identify isolation beds, and the isolation beds are not only in in government establishments, but we have also liaised and we have
with the private hospitals as well.
Cooperation and help of the military hospital. Private are there, but then we have the military hospitals and the and plus the police unit hospitals. So all have come on board, and all are ready
contingency
to
measures,
give any support.
Absolutely, contingency measures put in place by the Nagaland health authorities, not only the government hospitals and private hospitals, but they are also in touch, keeping the military hospitals as well as the police facilities ready. And I am sure this will be done by the other states, or being already done by the other states in the northeastern region. Very quickly, going to you, Dr. Ifat Mannan in Philadelphia once again. As a leading pathologist, Dr. Mannan, do you think there can be errors in tests? You see, we are depending so much on the tests, to determine whether someone is infected with coronavirus or not. As a leading pathologist, do you think there can be errors in tests to determine if a person is affected with coronavirus?
Talking about the test to detect the disease, it's actually a very sophisticated molecular-based test, which is called PCR. And to the best of my knowledge, I'm not aware of any errors, either false positive or false negative, out of this test for the disease. I have talked to a couple of my friends in Assam, and I am aware that in Assam too, the test is available in all the government medical colleges in the state, and they are doing it, and the result is available within a day. I would like to emphasize here that this is something very important that the government has to do, because there has to be more and more testing facilities available in the state outside of government colleges alone. Because if we don't know the number of patients who are having the disease, it would be impossible to isolate them. And that is where actually the US has done badly. And if you look at some countries which have contained the disease well, like Singapore, Taiwan, Thailand, Japan, South Korea, they have done well in doing lots and lots of tests. So that is one thing where actually we have to work on. And I would emphasize that there has to be more and more test-taking centers available in the state.
All right. I think Mr. Samit Sinha, I think Dr. Rifat Mannan has made a very important point. He's saying that, more testing facilities outside of the government facility, government hospitals also is necessary. More testing facilities, that is the key. He cited some examples how some of the countries have contained. Need is to isolate people who are affected. We need to first of all know who is roaming around, with the virus. Now, what is the plan ahead? What are you doing as far as the private sector healthcare facilities are concerned? Are you in touch with them?
Yes. As I initially stated and pointed out, that we need to screen everybody who is coming. This process has already started at Guwahati Airport. Not only at Guwahati Airport, we have got 5 other airports also in Jorhat, Tezpur, Silchar, Dibrugarh, and Lakhimpur.
Yeah.
So this we have started. In fact, the passengers coming via the flight route, they are all being screened 100%. This is one. Secondly, all passengers. In fact, I must tell you that there was a time when people were not coming in hordes, in large numbers. People belonging to Assam. Now they have started coming back to the state, either from the southern states where they work, or our own students who are working, who are studying everywhere. In fact, could be Maharashtra, could be Karnataka mostly.
Yeah.
So they are coming back now. So we are doing 100% screening. In railway stations also, all the important railway stations, starting from Kokrajhar to Bongaigaon to Guwahati to Mariani, Jorhat, everywhere. In fact, the deputy commissioners have been told very clearly to organize in consultation and coordination with the railway authorities. This is one.
Yeah.
One important thing is that anybody who is having any exposure in the last 14 days or last 28 days to any such visit of any country, what we need to do is that, in fact, there is a difference between quarantine, home quarantine and isolation. And you asked about the different protocols in the treatment. And depending on the treatment, it is all symptomatic treatment that is provided. In some cases, wherever required, where the patient their condition deteriorates and renal failure or maybe some lung complication develops, we have to provide oxygen and ventilator support also.
Okay.
In the state of Assam, coming to the moot point, we have got these 6 medical colleges up and functional. Difu is the 7th medical college which is there. And we have already identified the beds, because these are one thing. This is not the ICU where you can house everybody together. You need to clearly segregate such patients.
Yeah.
So we have identified such places, fortunately, in all the medical colleges and also the district hospitals.
So we will talk.
The private hospitals. The private hospitals also we are in touch with. And all important centers. Obviously, Guwahati has a large number of private hospitals.
Have you also directed them to keep beds ready?
Yes.
To keep ICU facilities ready?
Yes.
So the breaking news again, Mr. Samit Sinha is saying, the Principal Secretary Health Government of Assam is saying that private hospitals in the state have also been directed to keep isolation beds, isolation wards or beds ready to deal with coronavirus patients, if at all necessary, outside of the government facilities. That is the thing. I'll have to go for a short break, but before that, very quickly, Dr. Raman Talukdar, I will let you go, but with my last question, Dr. Raman Talukdar, my last question to you, are you getting people voluntarily coming to the Guwahati Medical College to get tested, or you are getting patients, only those who are screened and found to have high fever in airports and railway stations and so on? Do you think people are coming on their own saying that I am having these symptoms, please, I want to get a test done? Do you have this kind of people coming to your hospital?
both the quality of patient we are getting. Patients are referred from by airport authority. Patients are referred from ISBT and also from railway station. They are communicating, but there are a group who are coming of their own. If somebody is having fever, somebody is having cough, they are also coming, and accordingly we are arranging to get him or her tested. And if he is totally asymptomatic, then there is no point of going for the collection of the swab. Accordingly, both the quality of patients are coming to my hospital.
So do you have a separate counter? Do you have a separate desk? Suppose somebody goes to Guwahati Medical College, is it a very big hassle for them, lot of paperwork, or have you made things simple? Dr. Raman Talukdar.
There is a counter being earmarked with a control room in the entry point of the emergency department, and after coming to the emergency department, hello.
I can hear you. Please
Hello?
carry on. Please carry on. Carry on.
Hello.
Yes.
The patient coming to the patient coming to the emergency department. There is a separate counter made at the entry point, which is manned by the control room, and they are getting the phone call, and they are also responding to the patient arriving that way. And by the side of that, the registration counter is there. Then ultimately the casualty officer on duty, who remains 24/7 there, they arrange the logistic and they take the patient for examination, which is located separately. And within 2 days, I have already stated that the visit of WHO and UNICEF, then one area is being earmarked where the person suffering from cough fever will be directly guided to that area where screening and collection of sample will be arranged.
All right. I would like to thank you, Dr. Raman Talukdar. I'll have to go for a short break, but when I come back, I'll go straight to Kohima, Itanagar, and Imphal, and of course, our panelist, Mr. Samir Sinha, in the studios. Don't go away. I'll be right back. Welcome back. Dr. Dipu Loang in Itanagar. Dr. Loang, are you comfortable? Do you get a comfortable feeling now that the people of Arunachal are sufficiently aware? And how many testing facilities do you have, or do you have at all? Okay, Dipu Loang, can you hear me? Okay, sir, there is some audio problem. I'll come back to you. Can you hear me, Dipu Loang?
Yeah, now
Okay.
here.
Yeah.
Yes.
So my question.
Yeah, I can hear you.
My question was to you, Dr. Dipu Loang. Do you think that the people in Arunachal Pradesh are now sufficiently aware of the coronavirus? Do you have testing facilities? Are you comfortable about the situation?
When I talk about the awareness, like we have given enough awareness on this COVID-19 to the states, the people especially, to all districts and now through DDK, through radio, through print medias, and many ways like we could do. We have been giving awareness on this.
Are you involving the community, Dr. Loang? Dr. Loang, are you involving the community leaders?
Yes.
Are you involving the community leaders, the village headmen, the chiefs?
Yeah. This has been given to all the districts to just give it to those things like awareness among the community. So the point right here is like even in spite of there is a little bit of some degrees of fear, psychosis, still there, some panic still there in the people's minds regarding the COVID-19, since like it's like a multimedia this one through any media, social medias, people have been given all the fake news and this and that. So it's been circulating around, you know. So these are some of the reasons, like the communities are more on a panic side, though we are giving all that awareness. And next 2 weeks will be crucial for the states, like because so many people, students, and
all right.
things
So,
have been come back to the
so
states,
there is
and
an
now
effort,
we are into it.
huge effort going on. You are also involving the community. Dr. Kikon, are you also,
Yes.
yeah, Dr.
Yes.
Kikon, are you also involving, prominent local organizations, whether it is the tribal HOHOs, whether it is the other community organizations, student groups?
Yes.
Can you tell the viewers a little bit about the extraordinary efforts that you are taking?
Yes, what we are doing here is we are using all platforms, whether it's the print or the electronic media, the social media feeds. We are using all available resources within us and all available organizations, the village bodies, the NGOs, even the various departments, they are also chipping in. And here what I would like to also inform you, Mr. Wasbir, is about the testing facilities. In Nagaland, there are no testing facilities. The designated testing facilities for Nagaland are in Imphal, Guwahati Medical College, Dibrugarh, and Jorhat. So through your platform, I would like to request all the authorities of the designated testing centers in Assam, request from the government of Nagaland, on behalf of the government of Nagaland, that when we send samples to these designated labs from Nagaland, to please facilitate that the reports are sent to us
have
as
you
soon as
sent
possible.
so far,
Because
for
the state
Dr.
of
Kikon,
Nagaland,
Dr. Kikon,
Yes.
so far have you sent any sample?
Yes.
So far have you sent any sample to these designated facilities?
Yes, at this present moment, as per the criteria, we have sent no samples to all these testing facilities. But as you know very well, that there is
let me give you
migration back
you
to
will
our
get an
state
assurance
of all
right
the
now,
students.
Mr. Kikon. We have the Principal Secretary Health Assam sitting with me on the studio. Let me ask him to respond to your request. Samisena, I would like to assure him right now.
Absolutely. We will be very, very happy to assist and support. As I told in the initial remarks, that there are 4 labs which are functioning in different parts of Assam, and we will pass on suitable instructions to them, and we have to support our neighboring states. There is no two ways about it.
So, Dr. Kikon, you have got an assurance.
I will convey that to yes.
You have got an assurance. You have got an assurance.
Yes. So I will convey that to my yes. Sure. I will convey that to the Principal Secretary, and maybe our Principal Secretary from his level also will get in touch with you, sir. Yeah, thank you very much for that assurance. Yes. Yeah.
So this is a small initiative. This is what happens when responsible officers come to programs like this. This is what happens when responsible officers comes to shows like this and create public awareness and help each other. At the end of the day, we belong to the Northeast and we have to support each other in these critical times. That is what has just happened on the program. Thanks, both of you. Dr. Thapa, you have a huge responsibility. NEGRIMS is one organization where everybody looks up to. So what is the level of preparedness in NEGRIMS from the medical point of view?
We have set up a screening center just near the emergency to screen the patients for the coronavirus. And from the screening facility, we have also developed a protocol which patients will be quarantined or isolated, or they may be admitted in the hospital. And we have also developed a task force for the coronavirus to educate the medical faculty members as well as our hospital staff, because they may be anxious that how they will handle the case.
Right.
So they are being trained to handle these cases, and we have developed a isolation ward also in the hospital.
So
that
you have done.
Can be admitted there and taken care of.
You have followed the protocol, and you are absolutely ready, Mr. Samisena. You know, the political leadership in Assam,
Right.
you know, they have been extremely proactive. Let us talk about the Health Minister, Dr. Himanta Biswa Sharma, and his deputy, Piyush Hazarika. Mr. Himanta Biswa Sharma, for example, yesterday, he spent as many as 6 hours along with officers like you and your team at the Guwahati airport and coming up with a standard operating protocol for passengers alighting at Borjhar airport. So tell the viewers something about these initiatives.
Yeah, in fact, we are very fortunate in the state of Assam that political leadership has really taken this cause, and many meetings been conducted, review meetings conducted at the level of Honorable Chief Minister, Honorable Health Minister, and Honorable Minister of State Health. They have been leading from the front. In fact, as you rightly pointed out, yesterday, Honorable Health Minister, Dr. Sarma was there himself. The entire team, in fact, all of us were there, right from which should be the entry and which should be the exit and what would be the kind of support that we are going to provide to our health personnel there, the kind of training, apart from the thermal scanner, which is a handheld device, to mounted camera, which has kind of a high resolution camera, thermal scanners. Everything was devised, and we have issued, in fact, we are one of the few states which have issued a very detailed SOP. Who will do what? CISF responsibilities, Airport Authority of India, our state government, ambulances, how everything is going to be lined up, how everybody, irrespective of origin, is going to be screened. So in fact, the political leadership has been very, very supportive, and now. Yeah.
May I ask you a follow-up question, Mr. Samir Sinha?
Yes.
You know, we have responsible panelists, officers from all the health departments in the northeastern region on this panel at this point in time on the show. Now, would you be willing from the state of Assam to basically have a meeting with the concerned officials in the state of neighboring states and share these standard operating procedures either in a face-to-face meeting or through video conferencing? Will you be willing to do that? And if so, are you going to take the initiative?
Yeah, we have issued many advisories, and in fact, as I told, that this is an evolving situation.
Right.
So every day, in fact, whatever advisories that we had taken out yesterday and brought out in the newspaper today in the form of advertisement, today, as you rightly pointed out, that we have closed down museums, library. So as situation is evolving, we are adding to that list of advisories. So everything, what we can do, I will obtain the number of the principal secretaries of all the northeastern states. I take this thing from here, and thereafter I can share it.
Okay.
Importantly, all the guidelines, notifications,
That will
SOPs that we have devised so far.
That will be great.
Yes.
Let me once again turn to Dr. Rifat Mannan. Dr. Rifat Mannan, the United States has begun the first human trial, you know, of a vaccine to tackle the virus. What is the update on this? How reliable is this? First human trial in the US.
Talking about vaccine, I think it is still quite early. Do we know that a phase 1 clinical trial was started in the state of Washington in the US? It is still quite early, and we are not sure when a vaccine will be available for clinical use.
Okay. Now, Dr. Rifat Mannan, how do you see the road ahead? Will things settle down, or do you think the spread is going to continue? What is your assessment?
It's a difficult question for me to answer, though I'm not an epidemiologist. What I see is that there is only a rising trajectory of the disease, and it's not showing any sign of slowing down. China bore the brunt initially, and now Italy is still suffering, and now it has moved to Spain, Germany, US is suffering from it, and I feel India is not very far away. There is a very recent statement by the chief of World Health Organization who says that it would be a very fatal mistake for any country to think that they will not be affected. I think he is right. And in fact, our own former chief of Indian Council of Medical Research, Dr. Jacob John, said that India might be the country who would be the next major target.
We cannot be complacent. I have to let you go, Dr. Rifat Mannan. My final question to you, apart from the usual preventive protocol, what would you like to tell our people?
I think it is very important for the people of India, including the entire Northeast and Assam to take the disease very seriously and to understand the imminent danger that is coming. And we need to behave responsibly. There are two ways to deal with it. One is at the individual level and one is at the government level. At the individual level, it is very important to behave responsibly. The most proven method that has worked in many countries and in the past is social distancing. That has to get into the mind of everybody. What it means is that to stay away from the crowd, to stay away from any gathering. At the government level, there are a few things that I think the government needs to do. The government has to impose strict measures so that the social distancing can be maintained. So there is something known as flattening the curve. What it means is that the health system always has a very finite capacity. You can see that curve behind me. If there are no protective measures, the number of patients will increase exponentially. What has happened in Italy? And the health system with limited resources will not be able to handle it, and that would be a complete disaster.
Absolutely.
So by protective measures like social distancing, we can try to flatten the curve.
Okay, Dr. Rifat Mannan in Philadelphia, United States, thank you very much for joining on the program. I am now just joined, although I've got only a few minutes left, I am joined from Imphal by Dr. Y. Mohem. He is the chairman of the Red Cross Society, Manipur. Dr. Mohem, welcome to the show. How is the situation? What is the news from Manipur? What about the preparedness? Are you happy with the efforts of the government? What is the Red Cross doing?
Mr. Wasbir, I am very satisfied with what the Manipur government is taking the steps to fight the coronavirus. We, on the part of our Red Cross Society, we have taken seriously for the mass campaign of awareness, right from the 8th March during the holiday, just after the holy festival. We Red Cross volunteers from Imphal West, Imphal East, we have 8 district branches in Manipur, Red Cross. And we distribute handouts under the direction of what WHO directed about the do's and the don'ts of the coronavirus. And during the Yauksang festivals, every locality, every club organized sports. So during the sport festivals, we went from the club to club where people gather for the sports. 100, 200 people gather, and there we deliver our short speech.
So Dr. Mohem, I'm running short of time. Dr. Mohem, so awareness basically is the key, and people have to behave responsibly. Is that going to be your appeal? Behave responsibly.
Yeah, our main basic is don't panic unnecessarily. People should be aware of how to improve the hygiene, hand washing, sanitation, how to cup using the elbow or tissue paper or handkerchief. Don't spit in the public place. When you have fever, contact the doctors and don't go to office or marketplace.
Okay, I only have 2.5 minutes left in the show. Final comments from you. Final comments from you, Mr. Dipu Lawang from the heights of Arunachal. What would you like to say finally, Dr. Dipu Lawang? Final comments, quickly, 20 seconds.
I want to say something.
Yes, please carry on. Who wants to say something? Is it Dr. Kikon? Please carry on. Very quickly, I'm running short of time. Okay, I can't, I think there is a line disruption. Please fix the line quickly. Mr. Samir Sinha, your final comments. What is your prediction? How are things going to pan out in the days ahead?
So these are extraordinary times, very, very unprecedented in the history of public health emergencies. So we all need to rise to the occasion. And we need to, as one of the gentlemen pointed out, we need to take care of ourselves, and also we need to take care of the community that we belong. The health personnel will need a lot of responsible tasks in the days ahead, and but these are we need a collective effort to combat this COVID-19 collectively.
Collective efforts to combat COVID-19. The government is already doing its best.
Yes.
And of course, the people have to behave responsibly. Final comments from you, Dr. Kikon. 20 seconds to you, quickly. I'm going to wrap up.
Yes,
Dr.
yes.
Kikon. Yes.
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 Yes. What I would like to, What I would like to express through your channel and through your medium is that information sharing is very important at these crucial stages that we are in. And in that regard, we are in touch with all our colleagues in all the states of the Northeast. So this is also one initiative we have taken, and especially when rumors and fake news are.
All right.
Really abound in these times. So we are in touch with all our colleagues in all the Northeast states, so that information sharing is the main thing.
All right, Dr.
To
Kikon.
dispel rumors and to dispel the fears and the panic. Yes.
We all have to share information, filter out the wrong information, share the correct information, and work unitedly. Dipulawang, 20 seconds to you, if you can hear me at all. Okay, Dipulawang cannot hear me. Anyway, I don't have time. Dr. D.M. Thapa, final comments. Dr. D.M. Thapa. Dr. Thapa, final comments. Okay, Dr. D.M. Thapa also cannot hear. Okay, with this, I have to end this edition of Northeast Tonight. Fortunately, we don't have any positive cases so far, but we cannot afford to be complacent. I think Mr. Samir Sinha will agree with me. We have no cases. We are going to fight this coronavirus, but we cannot afford to be complacent. And another point that has emerged from this discussion today is that the government has done their bit. Now it is the time for every one of us in the society to work unitedly, behave responsibly, weed out fake information. And for your information, 14 people have been arrested for spreading fake news in Mizoram. And I don't know, of course, I have figures of other states taking such tough measures, but if necessary, we have to be tough to deal with a situation like this. I thank all my panelists for participating in this program and the viewers for witnessing the show. Good night and goodbye.
Northeast Tonight, brought to you by Oil India Limited, conquering newer horizons.